She was eating less every day. Her owner thought she was just getting older, maybe a little picky, maybe slowing down. But the real reason was something far more painful, something invisible to the naked eye, happening silently inside her mouth for years. By the time they finally took her to the vet, the damage was already done. 3 teeth had to be removed. The infection had already begun spreading toward her kidneys. And the heartbreaking part? It was completely preventable. If you have a cat at home right now, and you have never once thought about their teeth, this video is the most important thing you will watch today. Here is a number that will stop you cold. By the age of just 3 years old, 80% of cats already show signs of dental disease. 80%. That means, if you have ever owned a cat older than 3, there is a very high chance they were silently suffering from pain in their mouth every single day, while you had no idea. This is not a rare condition. This is not something that only happens to neglected cats. This is an epidemic hiding behind closed mouths and quiet meows. And the reason most cat owners never find out? Cats are masters at hiding pain. It is a survival instinct hardwired into them from thousands of years of wild ancestry. A cat that shows weakness becomes prey. So they carry their pain silently, eating through the discomfort, purring through the ache, sleeping more to cope. They never complain. They never ask for help. They simply trust that you will notice. And most of the time, we don't. So what actually happens when a cat's teeth are never cared for? It starts innocently enough, with plaque. Every single day, bacteria in your cat's mouth forms a soft, sticky film on their teeth called plaque. In humans, we brush it away twice a day without thinking. But in cats, it builds. Quietly. Consistently. Within just 24 to 48 hours, that plaque hardens into something called tartar, a rough yellow-brown crust that bonds to the tooth surface and cannot be removed by eating or chewing alone. As tartar accumulates along the gum line, the gums become inflamed. Red. Swollen. Tender to the touch. This is called gingivitis, and it is painful. But it doesn't stop there. Without intervention, the infection travels deeper, below the gum line, attacking the roots of the teeth and the bone that holds them in place. Teeth become loose. Abscesses form. The pain becomes constant. And here is the part that truly shocks most cat owners. The bacteria from that infection does not stay in the mouth. It enters the bloodstream. And from there, it travels to the heart, the kidneys, and the liver. Dental disease in cats is not just a mouth problem. It is a whole body problem. And it can quietly shorten your cat's life by years. A cat owner shared her story recently, and it stayed with me for days. She wrote, "My cat Moshi was 9 years old when I finally took her for a full dental checkup. I thought she was healthy. She was eating, she was purring, she seemed fine. The vet found 5 teeth that needed immediate removal, severe gum disease, and early signs of kidney stress, all from untreated dental disease. I cried in that office for an hour. She had been in pain for years and never once let me know. I failed her without even realizing it. She didn't fail Mochi out of carelessness. She failed her because nobody told her that a cat's mouth needs attention too. Because nobody explained that silence is not the same as comfort. Because nobody warned her before it was too late. That is why you are watching this right now. So, how do you know if your cat's teeth are already suffering? Watch for these signs. Starting today. Sign number 1. Bad breath. A cat's breath is never going to smell like roses, but if it smells genuinely foul, rotten, or unusually strong, that is not normal. That is bacteria. That is disease. Sign number 2. Dropping food while eating. If your cat picks up food and then drops it, or chews only on one side of their mouth, they are telling you something hurts. They are trying to eat around the pain. Sign number 3. Pawing at their mouth or face. Cats rarely touch their own face. If you notice your cat repeatedly pawing at their mouth or rubbing their face along the floor or furniture, something inside their mouth is causing them discomfort. Sign number 4. Visible yellow or brown buildup on teeth. Gently lift your cat's lip and look at their back teeth. Healthy teeth are white or slightly off-white. Yellow or brown crusting along the gum line is tartar, and it means disease is already progressing. Sign number 5. Eating less or losing weight. Just like the story of Moshe, a cat in dental pain will often eat less, not because they have lost their appetite, but because eating hurts. Unexplained weight loss in a cat should always be investigated, and the mouth is one of the first places to check. Now here is the part that actually gives me hope. Because unlike so many health conditions, dental disease in cats is almost entirely preventable, and even when it has already started, it can be stopped. Step 1. Start with a vet dental checkup. If your cat has never had their teeth professionally examined, make that appointment this week. Not next month. This week. A professional cleaning under anesthesia can remove years of tartar buildup and give your cat a completely fresh start. Step 2. Introduce a cat-safe toothbrush. You do not need to brush your cat's teeth perfectly on the first try. Start by simply touching their lips with your finger. Then introduce a soft finger brush, then a tiny amount of cat-safe enzymatic toothpaste, which comes in flavors like chicken and salmon that most cats actually enjoy. Even brushing 3 times a week dramatically reduces plaque buildup and slows the progression of dental disease. Step 3. Use dental treats and water additives. There are specially formulated dental treats that mechanically scrub plaque as your cat chews. Water additives approved for cats can also help reduce bacteria in the mouth daily, with 0 effort from you or your cat. Step 4. Choose the right food. Wet food, as we have discussed before, is better for hydration, but certain dental kibbles are specifically designed with a texture that helps clean teeth as cats bite through them. Ask your vet which option suits your cat's specific needs. Step 5. Check their mouth once a month. Just 30 seconds. Lift the lips. Look at the teeth and gums. Healthy gums are pale pink, not red, not white, not swollen. Healthy teeth are clean, not crusted with brown or yellow buildup. 30 seconds once a month could catch a problem before it becomes a crisis. Your cat has never once complained about their teeth. They have never pointed to their mouth. They have never told you something hurts. They simply lived with it, quietly, patiently, the way cats always do. But now you know. You know the signs. You know what is happening inside that silent mouth. And you know exactly what to do about it. The greatest thing about this moment, right now, is that it is not too late. For most cats, it is never too late to start. Check their mouth tonight. Book that vet appointment tomorrow. Pick up a finger brush this week. Because they cannot ask you for help. But they are counting on you anyway, and now you know how to answer.